So, the question for today is: are pregnant women at a higher risk of getting COVID 19? So, while pregnant women do not appear to be at a higher risk of getting COVID 19 if you compare it to non pregnant people, studies have shown an increased risk of developing severe COVID 19 if they do get infected, compared with non pregnant women of a similar age. COVID 19 during pregnancy has also been linked with an increased risk of preterm birth. Additionally, pregnant women who are older, overweight, or have a pre existing medical condition such as hypertension, diabetes, or a particular serious, I'll say it again, this is too long. Cut, cut, cut. अभी stop करियो रुकना. हाँ. So, the question for today is: are pregnant women at a higher risk of getting COVID 19? While pregnant women do not appear to be at a higher risk of getting COVID 19 infections, studies have shown an increased risk of developing severe COVID 19 if they do get infected, compared with non pregnant women of a similar age. COVID 19 during pregnancy has also been linked with an increased risk of preterm birth. Additionally, pregnant women who are at high risk, like being older, overweight, or having a pre existing medical condition such as hypertension and diabetes, can have a particular serious risk outcome of COVID 19. So, it is important that pregnant women and the people around them take all necessary precautions to protect themselves against COVID 19. If they do become unwell and have symptoms such as fever, cough, or difficulty in breathing, they should seek medical advice. And of course, do get vaccinated against COVID. There seems to be no specific reason for concern for getting vaccinated during pregnancy. And in fact, leading organizations such as WHO have recommended that pregnant women should get vaccinated. Next. So the question for today is monsoon a predisposing factor for more illnesses? So the question for today is: does monsoon cause an increase in illnesses? So, monsoon is a beautiful season where everything around is lively and green, but the high moisture content in the air during this time facilitates the growth of harmful microorganisms and can lead to transmission of several diseases. The diseases during monsoons can be transmitted through four main mediums: mosquitoes, water, air, and contaminated food. Mosquito borne infections and diseases include malaria, dengue, and chikungunya. To prevent these, maintain hygiene, use mosquito nets and repellents, and don't let water collect near your house. Water and foodborne diseases include typhoid, jaundice, cholera, and GI gastrointestinal tract infections. What can you do? It is very simple. Boil water before consumption, wash fruits and vegetables thoroughly before eating or cooking, Wash your hands frequently, maintain hygiene, keep the foods covered at all times, and try not to consume outside food at this time. Cold and flu are also common during this time, so cover your mouth and nose while coughing and sneezing. Keep away from infected people, just like we are getting used to during the COVID time. Maintain adequate hygiene and ensure that your home is well ventilated. Eat a balanced diet and try to wear half sleeved. Eat a balanced diet and try to wear full sleeved clothes. Enjoy the rains. Remember the dictum: boil it, peel it, or forget it. So, the question for today is: do kids need to be vaccinated to attend school? Well, the WHO says no. Actually, Dr. Catherine O'Brien, a member of the WHO expert committee, said that there is no need for teenagers or kids to have to be vaccinated in order to attend school, and they should not act as a barrier for them to attend school. In fact, it is about the protection of the adults at home that the children pose a risk. The Global Health Body said that it is more important for the adults around the children to be fully vaccinated so that they don't get the infection from the children. The director of All India Institute of Medical Sciences in New Delhi has also said that the country should consider reopening schools in a staggered way, particularly in districts that are seeing less of the virus circulation. The WHO says that certain things should be monitored after reopening schools in order to devise further policies for the safety of the children and the staff. These include effectiveness of symptom monitoring and reporting, rapid testing, and tracing suspected cases. Effects of policies and measures is on the health and well-being of children, siblings, staff, parents, and other family members, number of cases in children, number of cases in children and staff in the school, and frequency of school based outbreaks in the local administrative area and the country, etc. So, till the time we have a vaccine for children, all adults should get vaccinated so that our kids are protected and we are protected. So, the question for today is India experiencing the third COVID wave? Well, it doesn't seem so. Health experts say that the third wave of COVID 19 has not yet hit the country, and the surge in cases in certain parts of the country, such as Kerala and the Northeast, is part of the second wave driven by the Delta variant. Several projections suggest that the third wave may hit India in August and may peak in October. However, the ground situation may be different from the mathematical model, as these waves depend on human behavior and vaccine coverage. Whether it is the second wave or the third wave, it doesn't really matter. The interventions and the precautions remain the same: masking, social distancing, and hand hygiene. So stay safe, and stay happy and healthy. So, the question for today is, can breastfeeding transmit COVID 19 infection? The available evidence shows that the COVID 19 virus is not transmitted by breast milk. COVID 19 spreads through droplets released during coughing and sneezing and aerosols. The virus enters the body through the eyes, the nose, the mouth, or when a patient The virus enters the body through the eyes, nose, and mouth when a person is very close in contact with a patient or through contaminated hands coming in contact with the face. The World Health Organization recommends exclusive breastfeeding for infants born to COVID positive mothers without significant risk to the infants. The only condition is that the mother must maintain respiratory hygiene, wear masks, and wash hands frequently with soap and water or use a hand sanitizer with more than 70% alcohol, especially before and after breastfeeding. Moreover, breastfeeding can protect the baby against coronavirus infection by secreting antibodies produced by the mother against the virus. Breastfeeding is essential for the health of the baby, develops good immunity in them against various diseases, and helps with adequate growth and development. So continue to breastfeed your baby without any fear. And remember, breastfed is best fed. Why do you come and disturb me when I'm recording?
All time.
मैं बोल रही हूँ तो इसका मतलब रिकॉर्ड ही कर रही हूँ ना.
हाँ तो 10 मिनट अंदर आ गया.
But you're distracting me, no?
हाँ. मैं कह रहा डिनर के लिए घर आ जाओ.
कौन?
सुबह.
कहाँ पर?
देखो.
You'll drive.
हाँ.
I believe I've forgotten how to tie a scarf. Can you imagine? Something that I do so just forgotten how to tie it. How is it possible? So the question for today is, what foods can I eat if I have diabetes? Many people worry that having diabetes means they cannot eat the foods that they enjoy. But that's not true. You can still eat the foods you like, but you need to eat smaller portions or have them less often. Have a diabetes meal plan created by your healthcare worker that meets your needs and likes. Eat a variety of foods from all food groups in appropriate amounts that your plan mentions. The food groups include vegetables, fruits, grains, proteins, and low fat or non fat dairy. Consume heart healthy fats, which mainly come from foods like oils that are liquid at room temperature, such as canola and olive oil. Nuts and seeds, heart healthy fish such as salmon and tuna are very helpful. Use oil while cooking food instead of butter and cream. Remember, sweet is not just sugar, but all the foods that are converted to sugar in the body, like carbohydrates and also fruits like mangoes, bananas, custard apple, chicos, and grapes, which are very high in sugar naturally. So practice a little moderation and choose wisely, and you should be able to enjoy your food fully. Thank you. Ritu? Ritu?